Hi, welcome back, guys. So today's listener submitted question was, hey, what are some things that are toxic that are common around the household? So I'll kind of break it up into two different parts. Some of what have I been seeing lately that's been toxic in patients, and then a few that are just common general household things. So thank you for the question, appreciate it. And here we go. So the first one, this is a little bit more of an older school thing, but antifreeze is a really big one. Traditionally, it used to taste very sweet, therefore patients would smell it, smelled sweet, taste sweet, drink, 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 and then it would lead to pretty severe problems, generally affecting the kidneys, and some of those are pretty life-threatening. Another old school one is lead paints. That's generally a problem for houses that were built, 1978 and previously. Other common things are going to be similar to what you don't want toddlers to get into. So eating batteries, those can be corrosive, the pennies, various toxic chemical things. Some that you generally don't have to worry about your child getting into, but pets tend to do, is toilet water. A lot of times there's all kinds of chemicals, bleach and Clorox things. I have definitely seen a handful of patients drink toilet water. Dirty or not, I don't know, but definitely those that have been cleaned or have the different things, and those definitely do irritate the GI tract. Some of the other local ones that we have been seeing recently, we have seen rodenticides, so different rat poisons, chocolates, that's kind of a common one that we do see. One that's very specific and local here in El Paso that very few people know about, and we'll probably just do a different video on this one, but oleander toxicity. Oleander is a plant, it looks beautiful. There's pink oleanders, there's white oleanders, there's different versions, but it grows very, very well throughout El Paso and in general in just desert environments. I have seen it throughout Arizona, because that's a very similar environment to El Paso, but it does grow well there. I would assume for those of you in Nevada and Utah, also present, maybe a little less so in Utah because that's more of a high desert than a low desert plain. But just FYI, oleander you really want to watch. It can be toxic in all forms, from smoke to eating to laying on, absorbed in water bowls, so on and so forth. Like I said, we'll probably save that one for another day and do a different video for oleander toxicity, mainly because it's just so widespread here in the El Paso area that it warrants its own discussion. So those are probably some of the big ones that we see for the most part. There's obviously all kinds of other things. One that a lot of owners don't think about is if you're a geriatric, or if you have family members or live with somebody who's on human medications. I have come across a few cases where the patient gets into the human thyroid meds or pick a disease, they get on some kind of medication and eat the bottle of medication. Obviously, depending on the medication, that varies what can happen, if it's a problem, if it's not, and so on. But those are probably some of the ones that we've seen recently. Two other ones that come to mind are weed toxicity, and we definitely see a lot of patients get into, whether it's a friend's or a family member's weed stash, brownies or CBD cocktails with more than just CBD in it. But those are things that we have seen very recently, and a good handful of them. So watch out for some of those things. Hope that was helpful, guys. Thank you for your feedback. Have a blessed day.